Welcome to the NIHR Dementia Researcher podcast, brought to you by dementiaresearcher.nihr.ac.uk in association with Alzheimer's Research UK and Alzheimer's Society, supporting early career dementia researchers across the world.
My name is Hannah Churchill. I'm the Research Communications Manager at Alzheimer's Society, and I'm delighted to be guest hosting this podcast for the Dementia Researcher website today. So thank you to Adam for letting me loose on this. Today we're joined by Claire Pentecost from the University of Exeter, Remco Tout and Remco Tout from the University College London, all Alzheimer's Society funded researchers. We'll be discussing the impact of the pandemic has had on their work, how they're rising to the challenge and adapting their research programmes to understand the impact on people affected by dementia and provide evidence-based support and guidance. Alzheimer's Society itself has been badly affected by the pandemic as well, so we'll be touching on the impact that's had for our research programme and our commitment going forwards. So, as we're all aware, we know that people with dementia have been hit badly by the COVID-19 pandemic. Over a quarter of people who've died with COVID-19 from March to June had dementia. That's over 13,000 deaths. The largest increase in excess non-COVID-19 deaths was also people with dementia. And those living through the crisis, the effects of social isolation have been severe for both those with the condition and their carers. Alzheimer's Society has been supporting dementia research for decades now, taking on dementia from all angles, seeking to understand the underlying causes of different types of dementia, looking to develop new treatments and understanding how it can be prevented. Alongside this, Alzheimer's Society is also the UK's biggest charitable funder of dementia care research, which we're going to be taking a look at today. Alongside the Economic and Social Care Research Council and the National Institute of Health Research, we held the first Dementia Care Research Summit earlier this year, and we're seeking to raise the profile of this area of really important research. And the current pandemic has demonstrated the challenges associated with dementia care and the immediate need for focus and greater investment in this important area. So, without further ado, let's meet our guests for today, who are going to talk a bit about their work, how it's been affected by the pandemic, and how they are adapting to consider both the pandemic and dementia in their work as we go forwards. So, it'd be great if we could each introduce ourselves. Shall we start with, let's start with Claire.
My name is Claire Pentecost. I work at the University of Exeter within the REACH programme of work, which is all about dementia and understanding how we can best support people with dementia, and that's headed by Professor Linda Clare. So I work on Ideal 2. So Ideal 2 is funded by the Alzheimer's Society, and it's a large project including six different aspects of work to try to understand how we can help and support people to live well with dementia. So it's understanding what living well with dementia is for people and their care, people with dementia and their carers, and guidance, trying to provide guidance and support using that information and that data. So the different aspects, which I might go into a bit later on perhaps, but yeah, my job is the programme manager, so I sort of help coordinate all the different work streams.
Wonderful, thanks Claire. Okay, let's, Nurea, would you like to introduce yourself and your focus of your research?
Thanks Hannah. As Hannah said, I'm Remco Tout and I'm a Senior Research Fellow and an Alzheimer's Society funded Fellow based at the Marie Curie Palliative Care Research Department at UCL. I was given some funding by the Alzheimer's Society to do a fellowship looking at family carers' experience of compassion. And that's when we talk about compassion, we're talking about compassion not just for the self, but also for others. And my fellowship also involves developing a compassion-based intervention for family carers. So we know obviously that caring can be so difficult, and despite the best that they do, family carers can still experience and report experiencing quite difficult sort of self-critical thoughts about how well they're doing. So I want to tap into new ways of developing interventions that can help carers to manage sort of difficult emotions that arise as a result of caring. So my work involves developing a tool to measure what we think compassion might mean to family carers, and then working with family carers to develop a compassion-based intervention.
Wonderful, that's so nicely into the ideal work as well. Okay, and our last guest, Remco.
My name is Remco Tout and I'm a PhD student at University College London as well. I'm funded by the Alzheimer's Society through one of the Centres for Excellence, which is actually based in Newcastle, the PRIDEM Centre for Excellence, which is looking at post-diagnostic care for people with dementia. So once they have a diagnosis, how can we support them? And specifically, my interest is looking at how access to healthcare is managed with people with dementia, as well as their carers, as well as their healthcare professionals. So I'm taking a qualitative approach by doing interviews with people with dementia, the carers they identify, the family carers, and the healthcare professionals that they see as important to their dementia care, and using that to really identify the different perspectives that they each have and bring to the post-diagnostic care that people are currently receiving, as well as what they would like.
We've seen sort of recently, and there's been, I mean, we've known for a long time, but the importance of sort of the holistic approach and the different elements of the care ecosystem, the importance of those different elements and the impacts that those different elements have felt during the pandemic. A really interesting area to explore. Okay, so like we've mentioned already, we know that dementia research has been hit very hard by the pandemic. We actually surveyed all of our researchers earlier in the pandemic. I think it was in July, and many of them told us their work had been disrupted and delayed during the pandemic for obvious reasons. So just reflecting on that, how have your areas of work been impacted, and have there been areas that you have been able to continue on your original planned work? And then maybe we'll go on to talk a bit more about this sort of COVID elements of your work in a minute. Let's start with Nuria. Would you like to go first?
Sure. So just before the pandemic, I was in the process of developing a tool. So my fellowship consists of 5 work streams, and the first 3 aim to develop a tool, following some qualitative methods using focus groups and qualitative interviews. So just before the pandemic, I was in the process of developing that. And what I was planning on doing was doing a large survey study with family carers to test the tool and to better understand what compassion means for them. Obviously, because of the pandemic, ethics committees sort of put a halt on approving amendments and prioritising more COVID-related studies. And in addition to that, NHS sites have not been open for recruitment, which has meant that basically my study has been put on hold until I can get back into the NHS sites to start recruitment. I've been in touch with obviously various NHS sites who are just all saying that it's probably not going to likely to start back up until the new year. So although I haven't been able to conduct this particular study, I have done some other COVID-related research, which I can talk about later.
Great, that's wonderful, thank you. Remco, what about your area of work? How have you been affected?
So my research method is doing interviews, and I'm primarily interested in people that are currently living in the community. So my interviews would have been conducted in their houses. Obviously, that is not feasible at all during the pandemic, as well as with regards to just the risk of bringing about contamination in general and other issues with that. So my research study received ethical approval earlier in the year, before the lockdown and everything else related to that came into place. So I had a study that was approved but didn't have any means of recruiting anyone because we couldn't feasibly do any interviews face-to-face. So in order to adapt to that, really, we submitted an amendment to focus on COVID-related elements as well, so that we could see if we could do telephone interviews and reach out to people remotely, which was a bit of a new area for myself as well as my supervisors, because doing telephone interviews without previously establishing contact with someone can be quite difficult. But I can talk a little bit more about that later. But yeah, so in that sense, planning to speak to people face to face was obviously just directly off the table as soon as we got an idea of how much impact this really had.
Yeah, huge problem. And Claire, the Ideal team, obviously a huge team and lots of different areas of work. So yeah, how has that been for your team?
Yeah, well, it was a little bit scary at the beginning for everyone, because obviously we had to rethink a few things. Similar to the speakers, there, obviously issues in contacting people and then recruiting them to do research. So one of the big elements of Ideal is a longitudinal study, which is over 7 years, collecting data from people with dementia and their carers to look at their trajectories of how they're doing regards to their health and their well-being and their feelings about how they're getting on. And we were collecting some data, time point 4 and time point 5, over basically had to stop in March. So we were sort of midway through time point 5, but a lot of people hadn't yet been contacted or seen. So unfortunately, that had to just end because we have research nurses going out across the whole country. So we've got 29 research sites across the whole country, seeing our people. We had a total of 1,547 people in the original time 1. So obviously we're trying to follow these people up as time goes on. So that had to stop, but what we did manage to collect some bits of data by post. Some of those things came in, and we did make some amendment changes so that we could collect some consent over the phone to tie some loose ends up. But primarily that piece of work has been delayed. So we've made other changes to the work, specifically some COVID-related work to try to mitigate some of those risks. And also, luckily, there are other work streams that we're doing, which are sort of more desk-based, so we can continue with those things, switch into that mode a bit more. So writing things up and looking at our previous data, which luckily we could continue with. So that was the initial change. But since then, the COVID stuff, this COVID research, luckily has been able to take off, which is great, because we can still ask relevant questions.
Yeah, so a bit of a shock to the system, to everybody in March, just really things grinding to a halt.
Yeah.
But on the bright side of things, nearly 50% of our researchers told us that they were also carrying on research focused on dementia and COVID as well. So we know lots of our researchers, including our guests today, have been instrumental in recognising the impact of the pandemic on people affected by dementia and adapting their work to investigate this impact. Of course, we can't make any changes or inform any policymakers of issues without carrying out this work and understanding exactly what's going on, the impact it's having, and providing evidence-based support and guidance for people who've been worst hit, like those living with dementia. So this is really what I was looking forward to talking about today, is finding a bit more about how your programs of work are considering the impacts of COVID and on people affected by dementia, and any outputs and observations you've made so far. What have your impressions been of people's experience of the pandemic and lockdown so far? It'd be really fantastic if you could share anything you have on that as well. So should we start with, let's go to Remco. Are you happy to talk a little bit about how you've been adapting your work and considering COVID and dementia?
Yes, no, I'd be happy to talk about that. So obviously back in March, when we heard about the full lockdown and we wouldn't be able to really go out, the idea of switching to remote interviews was something that we focused on and tried to figure out the best way of doing that in order to make sure that people with dementia and their carers could still be a part of research at this time. Once we'd figured that out and gotten the necessary approvals, we started recruiting mostly online, which was something that was more new to me. But at that point, the Joint Dementia Research Register came in quite handy, which is a national register, which is funded by the Alzheimer's Society, I believe.
We're a partner in that. Yeah.
Partner in that, which allows people with dementia to register their interest to take part in research that's being conducted. And so being able to contact people to see if they're interested through the Dementia Research Register was something that was crucial at the beginning, as well as the Alzheimer's Society Research Network, where I circulated the appeal to see if people would be interested in taking part in a telephone interview. So over the course of the last couple months, I've been able to interview the number of people I've been interested in, which is about 30 people with dementia, as well as their carers. We've made a decision to not contact the healthcare professionals that we were originally planning on including at the first time point, because that's where obviously the management of COVID for healthcare professionals, whether they're GPs or memory nurses or other specialists, needed to be prioritized. So we didn't want to put additional burden on them. So in the first time point, we were able to do a number of interviews with people with dementia and their carers, which was very interesting to hear about how they've been managing, and where my initial interest was on how they were engaging with healthcare in general. That now became, how have you been engaging with healthcare during the pandemic? So whether that be remotely, whether that be making the decision to go in person somewhere, and what kind of what factors into making those decisions. So especially in the early stages, we heard a lot about people who would refrained from going to any kind of healthcare encounter. So a lot was postponed, obviously, but a lot of people who might need emergency care decided not to engage with that because they were afraid of the risk of COVID. As things progressed, people started receiving more and more remote healthcare, so telephone calls or electronic consults from their primary healthcare practitioners or other members of the healthcare team that might be in contact with them, and discussing with them really what's been important to make those encounters work well for people with dementia and their carers, as well as not just in general with the provision of care, but also with managing that as a family member, as a person with dementia, and discussing that together or separately in some cases as well. So that's been very interesting to now sort of bring that to light as well. And as we go forward and think about the remote provision during the rest of the pandemic, or just in general, where we think we might adapt to healthcare systems, it's going to be increasingly important to monitor that as well, and to see what kind of experiences develop later on. So we're lucky that we are able to do secondary interviews to follow up and see what's changed since then, really, and how people have managed since then.
And what's your impression been of people moving to a more virtual healthcare approach? Has it been received well? It's obviously been a necessity at this point, but does it feel like it's something that could continue into the future and is something that's viable?
Well, I think there's always been this idea that pushing towards more remote provision would free up time for certain practitioners. So that's definitely been on the agenda for a while, and COVID sort of moved that up in a lot of places where that's something that we've seen throughout different healthcare systems. And it's important that when we move forward with that we still think about the people who might have difficulty accessing those kinds of care. And that is what we are seeing, that people with dementia and their carers are finding that difficult in some ways, but it'll be interesting to see as they maybe get more used to it over time, or if they can consistently see difficulties in engaging with that. Obviously, during the COVID pandemic, there was a huge shift all of a sudden in one go. And so the fact that we'll be able to speak to people again and see if they're facing the same issues or managing to find strategies for that is something that we'll then be able to communicate out and plan for, because that's something where we do see that people who have, where the family carer is a child, for example, they're much more comfortable in engaging with remote healthcare, whereas if it's a spouse who might be helping the person with dementia, they're finding it increasingly difficult. And not just for the care for the person with dementia, but also their own care on top of that as well. So that's definitely something that we're looking into to continue and follow up on that, to see what kind of experiences and what kind of strategies people are developing. Because overall, there's definitely a preference for face-to-face care, but there is an understanding that that's currently not possible.
Yeah, it's a reflection of this, as we've known always with dementia, the importance of person-centered and individualized care. Brilliant. Thank you, Remco. That's fantastic to hear. Let's go to Nuria. I know that you mentioned that quite a lot of your Alzheimer's Society funded work's been on hold, but it would be fantastic to hear a bit about your COVID area of work as well.
Yeah, so as I said earlier, I was unfortunately unable to adapt my fellowship work to sort of fit around COVID, but in the meantime, what we have done, so myself and Dr. Nathan Davis, also based at UCL, we were awarded an Economic and Social Research Council and UK Research Innovation Grant to study the challenges family carers and people living with dementia experienced during the pandemic and the sorts of decisions they've had to make. So we obviously we know that family carers have to make difficult decisions all the time, but this has been made even more difficult with the pandemic because a lot of people are unable to visit their family, the people they're caring for, obviously with all the stories in the media about care homes, and so they're having to make remote decisions without seeing the person they're caring for, and also sometimes making decisions with a healthcare professional that they possibly may have never met before, which obviously can be quite distressing. So through this work, what we did is we worked with the Alzheimer's Society and Marie Curie and Dementia UK, and we used various ways of trying to understand this. Obviously, like Remco and Claire, we're not able to do any sort of face-to-face research, but what we did is we looked at the Alzheimer's Society online community to get a better understanding of what sort of challenges and concerns that family carers were reporting. We also spoke to helpline staff at Marie Curie and Dementia UK, again, to find out what are people calling the helplines about. And actually one of the things that we come away with is ever since the pandemic, more and more people, like Remco saying, is those who are able to use virtual means of support, they are seeking support in different ways. So although they might not be able to see their GP or other healthcare professionals, what they're doing is they are resorting to online communities to get support from other carers, and also using support helplines that say people like, the Alzheimer's Society and Marie Curie and Dementia UK offer. So what we found was that a lot of the sort of decisions that people were making, we focus much more at the end of life and some of the difficult decisions that are usually made around the end of life. So this included things like whether or not someone should go to hospital if they become unwell, what it means to do a DNAR, resuscitation order. And what we've done is we've basically used all the information that we've gathered through all these different sources, and we've developed a guide to help carers make these difficult decisions. And what it does is it takes into consideration the wishes and the preferences of the person living with dementia, and whether or not they've made things like advanced care plans. We also, through this guide, we also provide tips for carers, such as, some of the COVID-19 symptoms to watch out for, because what we know is actually that people living with dementia may not present the usual sort of symptoms that have been sort of promoted through the media. So what we've done is we've tried to help family carers become much more informed about what to look out for, and then to make more informed decisions. So the guide is actually available. It's available on the UCL website, and we really hope that it's obviously useful for carers, especially if there is a second wave.
Yeah, absolutely. And we'll be sharing that on the Alzheimer's Society website. Actually, I think it may already be up there. Just following up on that. So I'm sure there were a whole swathe of different issues that people were concerned about, but were there any what were the sort of top 3 standout issues that you felt people were concerned about at caring for their loved ones or living with dementia at the moment?
Yeah, we found things like whether or not I should let a healthcare professional or a carer from outside come in and care for the person I'm caring for. The other one that we found that was quite, it sounds quite distressing, is whether or not people make a decision whether or not to put someone in a care home during the pandemic. So obviously if somebody has been hospitalised and they've become quite poorly and can no longer live on their own independently, do I make the decision to then move them into a care home? And then the other thing that's coming up quite a bit is about whether or not I should be visiting them, and if I do visit them, how do I visit them, and if I can't visit them, what sort of things can I do to make sure that they know that I'm there? So yeah, it's been a range of challenges and concerns, but they're probably the main 3 that have come out of our work.
Yeah, there's been a lot of campaigning and influencing work on the Alzheimer's Society have been doing around access and visitation for residents in care homes, and the challenges around that, but ensuring that we can do that in a safe way. We know that isolation has sort of been a good thing for lots of people living with dementia. Thanks, Nuria, that's fantastic. And moving on to Claire and the Ideal Project. I know there's been a huge amount going on, and we've already touched on this, you're adapting to consider the impact of COVID and the fact that will have on living well as well. So it'd be fantastic to hear a bit more about that.
Yeah, so initially, obviously, we had to get, we had emergency meetings with our project advisory group and our PPI group, our patient and involvement group, to think about what we could do in response to the COVID pandemic. We were hearing, like Nuria, we used some of the networks to try and think about what was happening in the community and how people were coping or not coping. And we heard that people were initially, there was a lot of panic and feelings of abandonment when people didn't really have very much information. And then people started to see that there was some gradual understanding about how the life could go on, and that some adaptations could be made to people's lives. So we heard that from the networks, and we also had some evidence based on what we'd already collected from Ideal about what we understood was important for people to live well. What we wanted to do is try to put together some guidance and support quite quickly based on what we knew, and using our colleagues and our networks to try to pull together some useful guidance which would be quick and rapid, because we heard that there was lack of information and cohesive information, and it was confusing. So there was one point of call. So we put together some leaflets, and they went onto a website, our Include project website. So we got funding to do that, and we worked with the Department of Health and Social Care and the Alzheimer's Society to think about what was needed. And since then, it's like 5 points of what you need to look out for to help yourself. And we've updated that based on some of the feedback that we've got and some of the changes that people have experienced, and they've also been translated. So obviously there's a wider number of people that can access those too. So that was the first thing that we did. So we got, like I say, we've got some funding to do that. And in addition to that piece of work, so this funding came from the ESRC, and it was basically a dementia initiative agreed with the Department of Health and Social Care, and funded by the NIHR, not the ESRC. That was the next bit. And basically, the other thing we wanted to do was to interview people with dementia, so we could go to the people who were already participants in Include, who were part of the longitudinal study, approach them and just ask as many people as we could to agree to an interview, to ask them in depth what issues they were facing, the problems that they had, but also the things that they were doing to help them cope, and also where there were gaps in services and what services they needed and they weren't getting. And also the positive things that were coming out of it, if anything, the positive changes. So we're just looking at those interviews now, and we're just trying to consider what it all means. And the good thing is that we did manage to get quite a few people really interested in talking. They're interested in telling us their experiences, and actually doing interviews over the phone with people with dementia. We thought that might be an issue or difficult. We had to get consent over the phone and that kind of thing, but the ethical approval process has been changed, so that has made things quite a lot easier. So we managed to get 22 interviews. That was a roughly split between people with dementia and their carers. And so so we found some interesting things. So we found that there were quite an interesting split between the levels of coping amongst people. So for some people doing really well, actually quite happy. Others that are doing not so well, and some people that are doing quite badly. But of course, a lot of people were suffering from isolation, and obviously the access to services had stopped, and people were starting to feel stressed and anxious in a lot of cases. And the issues that people were facing, the people that were doing less well, some of them their dementia had progressed, and they were having difficulties with their memory or their communication, for example. So there's some dementia specific impacts on people, which are over and above the normal things that the general population have experienced, which has obviously been very stressful for people. But interestingly, we didn't see a difference in levels of coping according to people's type or stage of dementia or their age. So that was quite, in some ways, that was quite reassuring, because it was about other things, people sort of finding difficulties for other reasons, or people doing well for other reasons. So one of the big things was about living alone. People that were living alone were doing less well generally, and so people who had access to support or had someone to help them, of course you could imagine that that would be more difficult if you're on your own and dealing with memory issues, especially if the services had stopped, you weren't getting your carer coming in to help you do your necessary things. We did also, on top of this, we also were able to re-invite some of the people back for some interviews. So we're interested to know what their changes over time might be. So for the ones that weren't doing so well, we're interested in what happened. So we interviewed those people, and we also did do some interviews with people from Black and ethnic minority groups as well. We had one person in the original group, which is actually fairly representative of the numbers of people that we see diagnosed with dementia in the community from Black and ethnic minority groups. We wanted to do a few more to see if there are other issues that we needed to think about. So generally, the people from Black and ethnic minority groups were very similar in lots of ways, same sorts of issues. But there does appear to be some problems of trust. So trusting the information, trusting the care they might receive. And so, we're looking into that a bit more to see how we may be able to address that in how the information is presented, who presents the information, what the content of the information needs to be, so that more people can engage with it. Because obviously it's important that people are informed and know how to stay safe, essentially. And in terms of the follow-up interviews, what we found is, of course, with the progression of the disease, at the beginning when we did the interviews, it was fairly early on, around April, May time. And the second lot of interviews were a couple of months after that. So there were some changes in the restrictions. So there were some easing of restrictions and people were allowed to go out a bit more. But there were two things. There was some anxiety about going out again. And some problems, some concerns about the community not being dementia aware and not being supportive or mindful of someone who might not be remembering the rules or not being able to distance properly. So there's some anxieties about that, and of course anxieties about catching the disease if they weren't safe. People weren't safe going out. But we also found people did improve. So as you would expect, some people might improve because there was less concern about the numbers of people that were ill in the community. And some people did change their mindset and think about, okay, well, I can overcome this. I can move forward. I can overcome my fears and go out and enjoy being outside. And so that was nice to see that some people, that some of the people that weren't doing so well did, some of them did make some improvements. So obviously, you have to look at people as individuals and look at their concerns, their problems, and their issues that they're having. And ideally, we really need to target information according to where they're at the time. And people can change and move and shift and learn. People did learn how to use the internet, and more people were doing that. But of course, as you both said, Remco and Nura, the importance of face-to-face contact is still really valid. And it's how can we incorporate more of that in the future, but in a safe way, but also help support people get online if, obviously there's a wealth of things that can be done online as well. And the great thing is that people can adapt and learn, and even people with memory problems and difficulties, it can of course they can. So there's some positive stories as well as clearly there being an issue and a need to make sure that people with dementia are treated, as a group that needs some attention, and need to be, their needs need to be considered.
Yeah, I mean, it's nice to hear that, it's been quite a bleak picture often. And I think, hearing some of the positive, or at least the adaptations that people are being able to make to be able to live well through the pandemic is really nice to hear for a change. But yeah, there's so much information coming out of the Ideal team, and it's really fantastic for feeding into implementing work, and it's really highlighting some of the priorities that we need to target to help people affected by dementia at the moment. So I know that the guidance leaflets that the Ideal team developed have been incredibly well received, and it's really fantastic to hear that they're being translated into other languages as well, to make those accessible to broader groups. So brilliant to hear. This is a question which I didn't actually include when I sent it around to you guys, but I wanted to ask, you touched on some of the changes to the ethics committees, some move towards people making perhaps recruitment and some processes in research faster and easier as a result of the pandemic and sort of this shift that we've been forced to make. I'll open this up to you all. Have there been any other sort of silver linings in learnings or adaptations that you've seen that you think will be sort of taken forward as we hopefully come out the other side of the pandemic, which will support dementia research going forwards?
I think our approach prior to COVID in recruiting people and collecting data from them, the Ideal program so far, the documents that we use to collect data are quite long actually. So what we do is, we see people face to face, we give them opportunity for breaks. It takes about 2 hours, and that it's fine. That's been happening. But with the shift and not being able to see people face to face, we did worry that it would be very difficult to collect data. That type of length of time on the phone, and how would people cope using Zoom or these things. But obviously it's clear that people can and do are able to have interviews. So one of the things that we had to do was we had to take consent over the phone, and we were concerned that can you get informed consent properly from somebody, making sure that they fully understand what's been asked of them. But the answer is yes, and you have to go through processes and check and talk to them and spend a bit of time. But of course, yes, it can be done over the phone. I've done it before over the phone in other populations. So it's nice to know that these things, of course, we can do that, and we can do it properly and ethically. And I think that the ethical committees and the process has been made easier in lots of ways and quicker. So we were able to get quite a quick response, which was really nice.
Yeah, definitely.
In order to get started on the ideal the COVID initiative, the ideal CDI work, and also a new one which I haven't talked about, but the Include project, which is another a way of collecting data, but we're going to do that over the phone, but using Qualtrics to collect the data rather than using paper forms and things. But yeah, so it seems like there's been a lot of energy to try and make it work for researchers. There's been a lot of energy put into it to make it easy to do, quick to do, and but still good. It's still a good process. So that's a nice shift. Hopefully that will stick around, because that's easier for everyone.
Yeah, definitely. Yeah, Nuria.
Yeah, just sort of echoing what Claire was saying. I mean, with the COVID grant that we got the grant and ethics permissions to do qualitative interviews with helpline support workers and to analyse some of the data from the Alzheimer's Society online community. And we did the project and developed the decision guide within 4 months. And that involved getting together all the PPI who helped us basically inform the development of the decision guide. We had experts who met up as a focus group, including Tim Beagman from the Alzheimer's Society. So I think it's basically, like Claire was saying, everybody sort of just came together and just thought this needs a rapid response. And similarly with the ethics committees, they prioritise a lot of the COVID studies, which meant that, we got ethics within a week. So it's been incredible.
Yeah.
So it's
more of that, please. Definitely. No, I mean, it's definitely something.
Definitely exciting to get something back that quickly. It was like, right, we can get going then, we can get started. And it's fantastic. The research is needed now. We need to collect this data now because it's happening now. And of course, COVID's changing rapidly. So that was fabulous. Very unexpected.
Yeah, let's hold on to that as much as possible. So one last point, just because otherwise we'll be talking forever, which I could very happily do. I have to ask this, as Alzheimer's Society Research Comms Manager, we've been hit very hard by the pandemic, and unfortunately, as I'm sure all of you are aware, we've paused our research funding programme for this year, and we've had to adapt a lot of our other services and work as well. And medical research charities anticipate a 40% reduction in research investment this year. So I'd really love to hear just very briefly from each of you your experience of and why you feel medical research charities like Alzheimer's Society are important, particularly for early career researchers, and if your sort of concerns in that area. Let's start with Nuria, just really quickly.
Yeah, I mean, getting a fellowship from the Alzheimer's Society was an absolute incredible achievement. It was, I mean, it's not an easy process, but it was an incredible opportunity, and the advice and the help that I got and the support I got from the Alzheimer's Society has been incredible. I mean, just in a nutshell, it basically allowed me to spread my wings, as they say, and to follow my own interests and passions in dementia research. And so I was able to do the things that I wanted to do and take my interests further. So yeah, in that sense, it's been a great opportunity.
Yeah, so important for allowing the early career researchers to do that. I don't know if Claire or Remco wanted to add to that.
Yeah, I mean, I'm in my final year of my PhD now, so this is really the point where I am starting to think about the future career that I can have. And I think the Alzheimer's Society has really created such a great environment for dementia research as well, in encouraging it, in supporting it, in funding it, but also just trying to move the field forward. And I think that's something that I've been able to see, not just through my PhD, but also before. And that's something that's so exciting. And it is a bit of a shame that there is that worry now with regards to the funding, with regards to what is the future at the moment. And I think that's where seeing the Alzheimer's Society coming together and, writing that letter to the government, asking them specifically to continue this funding, to make sure that we can continue doing that. To me, as an early career researcher, it just means a lot as well. So thank you.
Oh, yes, absolutely. Our pleasure. We fully appreciate how important our early career researchers are, and we need to safeguard the future of dementia research and make sure that we continue to support that. And at this stage, we fully anticipate being able to continue our research funding next year. It's obviously a volatile situation, but we hope that will be the case, and we're committed to supporting research going forwards. So we'll touch on a couple of things. So, Claire, yes, absolutely.
So just, I've come from a different, I'm not a dementia expert, but I've come from the different populations, all different things. And this particular program of research is a really good question. It's a really sort of important, centralised question about how can we help people live well. It's not to ignore the fact that people can live well and do live well, and how can we best support that? So it's a really important question. And the Alzheimer's Society, by funding this big program of work, there will be so much information, although it already is coming out, that has been used by the Alzheimer's Society. And the Alzheimer's Society, we have a really unique position to be working closely with the Alzheimer's Society in their thinking about policy and impact for the future. And so we're guided by what's current, what's happening, and how can we best put our findings into practice, but also to be guided about the most important questions in some of the current things we're working on, to make sure that is impactful for the future. So that for me is extremely exciting. And in the current climate, with certain uncertainties with funding, we hope that this work will be finished and completed. But all the way through, the Alzheimer's Society have been able to talk to us about what we're doing and how we're doing it, and like I say, how to be impactful as best we can, which is very encouraging. So obviously we all hope that the work can continue, and we're able to put those really important messages out and complete it all in good time. But if not, it might be, we might extend that time frame and hopefully get it done a bit later on. But yeah, it's good stuff. It's all good. It's all really good research. So everyone, it's all really useful stuff that have an impact on people and their lives in the future. So that's what I'm all about.
Absolutely. I think that's the key point, isn't it? We really want to see that translated into impact for people affected by dementia, and that's why we're all here. So Alzheimer's Society are incredibly proud of all our researchers in the way that they've adapted and persevered through the pandemic, and we're, as I said before, we're committed to supporting dementia research going forward. You can find out more about Alzheimer's Society by visiting alzheimers.org.uk/for-researchers for all the latest news and updates on our research funding programme. It's also Memory Walk season, which is our flagship fundraising event, which I would be in trouble with our teams here if I didn't mention. So dig out your walking boots and sign up at memorywalk.org.uk. I'd like to thank our panellists, Claire, Pentecost, Remco Tout and Nurea Capelli, for all their time today. Thank you so much for coming along and shamelessly supporting Alzheimer's Society. We have profiles of all of today's panellists on the website, including details of their Twitter handles. If you'd like to ask any follow-up questions, or if you have any questions, do reach out. On the Dementia Researcher website, you'll also find a full transcript of this podcast. Finally, please remember to like, subscribe, and leave a review of this podcast wherever you get your podcasts.
Brought to you by dementiaresearcher.nihr.ac.uk in association with Alzheimer's Research UK and Alzheimer's Society, supporting early career dementia researchers across the world.